Jimmy Dura, host of All Things Veterinary, a podcast that connects and unites the animal health community with ideas and innovation, topics to inspire you and energize your day. And today we will be joined by our guests Matt Fletcher and Danielle Berry. Matt and Danielle are equipment specialists with Patterson Veterinary who specialize in supporting clinics specifically with equipment, everything from upgrading your dental x-ray to planning and filling out your entire new clinic. They have you covered. Danielle and Matt, welcome. We'd love if you would tell us a little bit about yourselves and about your backgrounds. Matt, if you'll kick us off.
Sure. Hello, Jimmy. Thanks for the invitation. I've been an equipment specialist for about 11 and a half years now with Patterson Veterinary, specifically on the veterinary side. Spent a lot of time learning year in, year out about the new things that continually seem to come into the equipment world in veterinary medicine, and really enjoy the job. A lot of fun, always new, always different. So yeah, that's me.
Awesome. Thank you, Matt. Danielle?
Sure. Thanks, Jimmy. So I've been in the vet industry for about 30 years, worked at an animal clinic. I have a background in interior design and also worked for a design build construction company that specialized in building veterinary hospitals. Put that together with my 18 plus years at Patterson, have a very extensive background working with doctors and veterinarians, helping them with their design process, helping them pick out equipment. It is a wonderful place to really meet people and help them build their dreams. And I really just enjoy it. And I think it's always interesting because there's so many new technologies coming out that we really love to share with our clients.
It's awesome. That is a lot of really great experience between the two of you guys. And Danielle, we'll probably touch more on some of the construction conversation in a bit. That's excellent and relevant experience. So I want to hit that. You know, the topic for today is trends. And I think we all can agree, you know, like you said, Matt, there's new technologies, new things coming up every day, every year. And over the last 5 to 10 years, you know, it just seems like everything has quadrupled in speed and change. And on the trends thing, I'm just curious to start kicking it off there with you guys. Are there any trends that come to mind that keep recurring in your day-to-day job that you're seeing out there in the field?
I think a day-to-day trend, specifically in veterinary medicine, we've seen is, you know, the sheer number and weight of pets and clients and the lack of numbers of veterinarians and technicians to see them. And so I think, you know, a big trend that we have seen, you know, in specifically in equipment is in items of equipment that can make a veterinarian quicker, more efficient, to get the same things done in less time. And even if that's to, you know, purely allow them to actually have a lunch as opposed to working through their lunch, or if that's actually just to allow them to, you know, just do more in their everyday working schedule. I think it's a really big thing. We've got a lot of different pieces of equipment that have, I think, helped veterinarians do that. That's one big thing that I've seen. How about you, Danielle?
I would agree with you, Matt, and I would say some of the wearable technology out there can help a doctor really see what's going on with a patient more quickly, and they can actually have that information when a client gets there, because that does seem to be a big issue staffing veterinary hospitals. I would say I see a lot of trends where your general practices are actually practicing more advanced medicine and bringing that into their facility as opposed to some specialty and emergency clinics, and not relying on them as much, bringing that into their hospital as well. CT, ultrasound.
Yeah, I was just going to ask you both to expand on that. First, Danielle, did you say wearable technology?
Yes, yeah.
Can you
So
kind of expand on that?
sure. So these are items that the veterinarian would actually send home with a client. Their pet would wear this. It would help to monitor the pet's activity, motion, vocalization. It can monitor their temperature, their heartbeat, ECG, and help give that veterinarian a really good idea of what's going on with the pet outside of the hospital as well, in a more comfortable home environment, and give them several days worth of data and trends so they can start to see what is actually going on with the pet.
Makes sense. Thank you. You know, and y'all already made me think of AI. And we won't get into that conversation, but that's a conversation for another day, because that's a whole thing that I'm sure we'll see in the equipment realm in addition to all the other technologies. But thank you. Danielle, you also alluded to some imaging, advanced imaging that folks are bringing in-house. What are you seeing in those realms?
Yeah, so I would say 5 or 6 years ago, I had clients that were a little more hesitant to bring on, say, ultrasound into their practice because they maybe didn't have anybody in practice who could read those ultrasounds. We're really worried about the learning curve of using an ultrasound. And we have products on the market now that we sell that come with such a good training module. With technology, they're actually able to interface with radiologists, learn how to do those scans, helping to bring on some of the staff and empowering technicians to be ultrasound technicians, actually, instead of referring those out or bringing in a sonographer to the hospital, would help keep that revenue in the hospital as well, instead of sending them out to a specialist.
That's a great point. The ability to be trained and kind of train while you're using it, or send out for a consult or hands-on, Zoom call training, especially ultrasound and other equipment, is it's changed the game, and not anyone can do it, obviously, but it opens the door. You don't have to travel, 300 miles and spend 3 days in a lab learning on that piece of equipment. You can bring the specialist to you basically with technology. Matt, anything you can think of to add to those, kind of other advanced
I think
modalities?
I think much like, any detective, a doctor, a veterinarian is putting together as much information as they can, right? Whether it's lab work, whether it's X-ray, whether it's just basic palpation. The more information they have, the better diagnosis they can make, and therefore the more accurate treatment they can prescribe to a pet. And I think what Danielle hit on there was some of the kind of the visual, whether it's ultrasound, whether it's, adding that on top of, say, X-ray, right? Because everybody's got an X-ray, it's pretty straightforward. But ultrasound allows you a different view, a more live view, more real-time view of what is going on to add to the X-ray images that you've taken. Then you can get into scoping, right? Like if you want to really take essentially a video camera and go into the animal's stomach or wherever that may be and actually have a look at what's actually physically going on in real time. Scoping is another option that a customer can have to be able to put, again, more information into the bag to decide on what is actually going on with that pet. And we can go on and on, right? I mean, there's CTs that veterinarians do to do this, MRI we can talk about as well. But there's some really easy 2D and 3D CT equipment that will also kind of fit a middle ground for vets who just want to keep adding nuances and elements to their imaging capabilities. And it's a big trend. I mean, Danielle, like you said, 5 years ago, when you went to do an ultrasound demo, the veterinarians would be a little bit afraid because they might not think it was going to get used, or they'd had experience where there was one in a practice they previously worked at, but the person that knew how to use it left and it was never used again, right? With the training and the imaging quality that's out there right now, I don't think anybody should be afraid of bringing extra modalities into their practice.
That's a great point, Matt. And, I think of the days when you encounter one of those clinics, like you said, maybe an associate left, something changed. There's an ultrasound in the corner and it looks like one of the original Apple computers. It's like a big box or something. Not only if they left it sitting there for a couple of years, the technology changed so much. Now it's either they can't pick up the image, was so bad, compared to what they can see today, or it's obsolete and out of date, and then it just goes unused even more. But now with the new technology on a lot of these pieces of equipment, they get updates, it seems, through that manufacturer. The box or the tablet that they get continues to get upgraded and enhanced. Does that make sense?
Yeah,
Am I right?
I think a lot of that's related to so many things being software driven now, right? Not that they weren't software driven, with the old what is it, Wall-E? Remember Wall-E? That's what a lot of those old ultrasounds used to look like, right? Or R2D2. But no, I think the ability to to send a remote upgrade electronically or plug in a USB and download an upgrade, if that makes sense. Yeah, you can get a lot more life out of your units these days. And I think what's really interesting about it, and when Danielle mentioned about the training element to ultrasound specifically earlier on, the fact that now, and I think COVID put this on steroids, but now you can buy an ultrasound and you only have to hold the transducer. The manufacturer at the other end can actually drive the entire thing, push the buttons, change the adjustments, so on and so forth, press record, send off your scan to a teleradiologist. And the person in the room who's doing the scan can get guidance on how to fan left, fan right, add pressure, remove pressure, whatever it is to find the image in real time. It means that nobody should be afraid to get value out of an ultrasound. I got vets who basically take it on as much for themselves, but for, they'll have a really sharp LVT who they know has got a little interest in ultrasound, or is kind of like one of those LVTs that can go another level with their daily work. And they'll actually use them to do the basic scans. They'll take the advanced scans themselves as the doctor, but the basic scans, they'll train the LVT, because these groups can also be set up to do 30-minute, 45-minute training, live training webinars, right? And that's not just a webinar, it's physically scanning a pet in the building whilst they're one-on-one watching you and training you. So there's so much of that these days with a lot of different modalities. There shouldn't be any fear of taking on specifically something like ultrasound or anything else, really. The training, if it's with the right groups and set up the right way, is there.
That's a great point, Matt. It's kind of like capturing the x-ray. The crew, the staff technicians can capture the image, call doc in to read the image that you get, ultrasound, x-ray, dental x-ray, same type thought. That's a great point. Here's a random question, and segueing, I guess, from ultrasound, but you touched on dental x-ray, minimally invasive surgery. So I want to kind of hit on those a little bit more, but here's a just broad question. What percentage of general practices would you guys say, and this is just a guess, not going to hold you to it, but that are utilizing ultrasound today? And I want to ask the same about dental x-ray and minimally invasive surgery and these other technologies. Care to venture a guess?
I would say of those, dental x-ray is probably the most used widespread. I would say it's standard of care these days. 5 years ago, opening a vet practice, that may have been a wish list item, and now it's mandatory. They won't open a practice without dental x-ray. Ultrasound's becoming more the same. I would say maybe 40 to 50% of the clinics I'm running across really would like to open their practice with an ultrasound. I would say non-invasive surgery is more up and coming. That's really starting to take off, but maybe 10 to 15% potentially in my area.
I'd agree. I would say 50% ultrasound, purely based on the amount of demos you're asked to do, right? I get a lot more demos on ultrasound these days than 10, 11 years ago. And then 10, 11 years ago, it was kind of similar for dental x-ray. Like dental x-ray was that not early adopter phase, but it was a phase where there was really a lot more justification that a veterinarian needed to do for the return on investment for dental x-ray way back when, again, 11 to 10 years ago when I started. Whereas nowadays, Danielle said, dental x-ray is really a standard of care. It's very rare I go into a practice where they don't have a dental x-ray of some kind. It might be some old school thing, but occasionally you do. I think a lot of the time with dental x-ray, I had one veterinarian who purchased, he actually went straight to the panoramic dental x-ray, which is, 3 times the cost. And when I kind of described to him the price difference, and I was wondering why he wasn't considering regular dental x-ray with a sensor, and his answer to me was, I could never see how I could fit in the time in my day to do full mouth dental x-ray with a sensor and how long that takes. So I never did it. And I was like, okay. I says, well, you realize this is 3 times the cost? He goes, yeah. He says, if it does it in 16 seconds, like you say it does, I can fit that into my working day, into all of my dentals, and not stress my staff and stress myself into trying to, add 15, 20, 25 minutes, for full mouth sensor x-rays. He says, so it's worth the extra investment. And that was one of those moments where, you think you know everything, right? And somebody gives you a whack across the face with an opinion that you go, all right then. Okay. So the panoramic, that was interesting from a time savings perspective for someone like that, right? With dental x-ray. But yeah, ultrasound 50%. I think the minimally invasive surgery aspect, whether it's electrosurgery, radiosurgery, ligature units, just vessel sealing, I think that's really ready to be heavily adopted, because I think new grads coming out and how much experience they have in doing a surgery. And I think everybody can understand how a surgery can go south, quickly, right? If you've got, for want of a layman's term, a bleeder going on, right? And the stress that can bring to that new grad, a vessel sealer, for example, or electrosurgery, which is cutting and coagulating and or sealing at the same time. I really think that's the next level, and purely because also the time savings, right? I mean, it's a whole lot quicker to do that, I would assume, than suturing everything. So for a number of reasons, I think that will be the next standard of care almost in vet med.
Well said, both of you guys. I didn't mean to put you on the spot with percentages, but I agree completely with what y'all said on those percentages and what I see every day in clinics. And I like the prediction, Matt. Let's see where we are here in 5 more years when y'all come back on the podcast and we look at minimally invasive. I think that's what I'm seeing too. And I think that's driven a lot by pet owner engagement, desire, their involvement, and the level of care that they're willing to pay for and wanting to see. I think they're more engaged. That's becoming not just something that's behind surgical doors that the client won't see. Obviously, they're not going to watch the surgery, but they care about the recovery, they care about the outcome, and they're willing to pay. And that seems to be driving, we need that, for it to make sense for a hospital to invest in that. You touched on one of my new favorites too, Matt, that I'd love to hit on a little bit more. And maybe you said it best and we'll leave it there, but the panoramic dental x-ray, I've got a clinic just invested in about 4 or 5 months ago, and their new hospital, brand new hospital. Two vets partnered together, and one of them had used that in another clinic, and he said, "I've got to have this panoramic dental," and he is loving it, and the time saved. And I've got another clinic that I took over to see it in his hospital, and he was like, same thing that your vet friend said, Matt, is I'm sold. I'm doing 5-6 dentals a day. They're working between two sensors that are about to be, not supported. And I'm like, instead of buying 2 more sensors, boom, get this bad boy. It's a lot quicker. I think because of, staffing challenges and busyness in hospitals, that those things, and y'all both alluded to this in the beginning, that save time, save headache, strife on the staff. That's a good investment. It's hard to maybe quantify some of that. What does it mean to make something easier for my staff to do versus what it costs? But I think we're going to see a lot more of those in the future as well. So I'm glad you brought that up. Danielle, anything to add on those thoughts or points?
I would say in regards to the non-invasive surgery, I've had the pleasure of sitting in on a few of those during training days with some of our manufacturer partners, and just seeing the doctors and how excited they are to be a part of that. I think it brings a little bit of excitement to their day, something different than the average spay, neuter, takes away a lot of the worry and stress with some of the more advanced surgeries, such as the splenectomies. And they really actually do have something really cool to share with that client afterwards. We have a shorter recovery time for the pet, which your clients always love, but being able to actually see inside the anatomy, potentially to see something else that's going on that they didn't know about, but just being able to, share a snapshot of the splenectomy or the spay, owners really appreciate that. And it really helps build that relationship between the veterinarian and the client. I think it's been a very exciting thing to be a part of. And if you have not had the opportunity to sit in on one of those surgeries, I would highly recommend it, because it is a super fun day, and it just really does bring something to veterinary medicine that I haven't been excited about in a long time.
As humans, when we go in for a knee scope, right, or whatever it is, minimally invasive is quicker recovery for us, right? So why would it not be exactly the same most of the time for your pet? Better recovery, quicker in and out, happier pet, happier owner, happy days. And if you can show some videos of it, right? If you took some still clips, video clips, whatever you were doing in that surgery, it shows value to your customer. Like here's where your fee went. Here's where your money went.
Completely agree. Sorry to interrupt you there. And also the clinic's ability to share these types of things on social media or just directly to their client, and the amount of money and time and love that we as pet owners invest in our pets. I want to hear about what's less painful or less recovery time. It's like, again, pet owners are kind of driving the desire for that. So you're right, Matt. It makes sense.
I tell you what's interesting, Jimmy, just a thought that sprung to mind as we were talking about that. The cost of veterinary medicine has gone up, right? You hear about it. I hear about it from my neighbors who do or don't know that I work in the industry, right? But I think the more that you can provide as a veterinarian, something that a pet owner understands and can see from. So whether that is a video, a still, whatever that may be from the procedure that you're doing, whether it's, and I go back to the 2D panoramic dental x-ray, the ability to, in 5 minutes, do a sedated scan at a wellness visit where you can give an accurate estimate of the number of extractions that are going to occur and show the photos ahead of the dental day being booked, as opposed to that range of $1,000 from, hey, when you come in for your dental, Mrs. Jones, we might have to do some extractions. We don't know until we've taken the x-rays. And so you got to sign off on an estimate that's got a range of about $1,000 from the lowest to the highest. I mean, that's transparency, right? Like, I think the more veterinarians can bring that to whatever reason higher prices are being charged to customers in vet med, it can't be a bad thing, can't be a bad thing.
Here's kind of a follow-up for both you guys. Again, this is a general just opinion question. Do you guys have an opinion on what can help a clinic be successful with a new purchase of a piece of equipment? And I know it's a very general question, and I'm not even giving you a specific piece of equipment, but does that spark anything for you guys?
I would say yes. I mean, if you use CT and MRI as an example, a lot of clinics would probably say at first, I don't know how I would implement that in my practice, but maybe there's one doctor on staff who has an interest in it. Let them be a champion of that and drive that in the hospital. Find another staff member, LVT, to be a part of that and let them run with it. It is an expensive piece of equipment, so you do have to get over those objections, but making that part of their standard of care, having staff that are excited to use that, and then having a support team of people who can train them, make them excited about it, make them comfortable with it. I think that goes a long way. If they're bringing on a piece of equipment just to make money off of it, maybe there's no passion in that. And I think them having a passion for why they're using that equipment to better treat the animal, have a better just understanding of what's going on, can really make an impact on why they're excited about the piece of equipment and why they've brought it into the practice. I think that's really key, just having someone who can champion that for them.
Yeah, I think what Danielle hit upon there is the pre-purchase aspect to it, right? It's don't buy something, and we're kind of like this with what we do, right? Because we don't want to have a piece of equipment go to a practice and it not work out, and then it's a very awkward situation to be in, right? So, the pre-purchase element of, when somebody asks you about a particular piece of equipment, whatever it may be, having an idea of that practice's physical infrastructure, right? Is this piece of equipment going to fit in here? Or is, for example, the one that you're looking at not, but we have another one that does, right? So that's the first kind of element. Buy-in from the staff, buy-in from the owner. Like, are there those excited people, passionate people about a specific modality or a specific service, maybe that the modality can actually then provide for? I think all that up front, discovering resistance and fears that some staff might have is the same kind of part of it, right? It's like, hey, X wants to bring this in, but Y is morbidly afraid of it. Why is that? And it might be training, or it might be something as simple as that, right? Where we can kind of recommend, one provider of or one manufacturer of a modality we sell over another one, right? Because we know, Danielle and I have been doing this for a long time. We have lots of different vendors for lots of different similar pieces of equipment, but they all have their own nuances, front, middle, and back end. So I think that, and then being able to just recommend the right thing for the right customer, for the right practice, for the right client base, that's really what makes the thing work, because you're kind of checking all the boxes up front to set yourself up for success, right? The old fail to prepare, prepare to fail line that runs around on many things. We do that as much as the clinic does that, right? We don't want to have a reputation of selling things to people that they just don't use and sit in the corner like a brick. I mean, that's just no good for anybody. I think during the adoption, there's an element of what Danielle and I do that if we don't do the training on something, specifically ourselves, or we don't have a hand in the installation or delivery of something ourselves, coordinating properly with a manufacturer and a doctor to make sure that it's actually, they're ready for it, they're ready to receive it, they're ready for how it's gonna come, how many crates, how many skids, how many boxes, linking them up with the person that is going to train them on it. And then following up 1 week, 2 weeks, 4 weeks later, like, how's it going? A lot of the time you'll find that sometimes people are afraid to ask for help or afraid to ask questions during any part of the process. But, afterwards it's like, hey, don't be frustrated, just reach out. And if we reach out to them, I think that also helps to, customize that experience to make sure that that piece of equipment is adopted well by the whole practice.
The All Things Veterinary Podcast is sponsored by Patterson Veterinary, supplier of products, equipment, software, services, and essentials for your practice. Patterson goes the extra mile to make sure you get what you need quickly, develops ways to help your practice run a little better, and backs it all with legendary customer service. Find All Things Veterinary at PattersonVet.com. Are there any examples come to your brains of specific pieces of equipment maybe helping a clinic differentiate from others in their town? And that could be from attracting pet owners, but probably even more especially towards attracting technicians, associate veterinarians, staff. Have you guys seen any of that in your areas?
I mean, 7 or 8 years ago, I would say that piece of equipment would have been digital x-ray when we had grads coming out, because that was one thing you saw grads do. Oh my gosh, I'm going to go to this clinic, but they're still using an automatic processor. Today it's getting rid of the CR digital x-ray and making sure that you have DR digital x-ray. I think ultrasound would be one of those things that they're using in school. Advanced monitoring. It's no longer just the handheld pulse ox that some of these older doctors are using. They really want to be able to test for end-tidal CO2, multi-gas, things that they're using in school that maybe not your average veterinarian was using 5 years ago. Now you're seeing that. And those are the things they're going to want to see. And sometimes it's just the look of the hospital. They want to work somewhere that doesn't look antiquated, somewhere the pet owner is excited to come and feels really good about it. It is a medical facility and they want it to reflect that when they walk through that door too. I think that's changed a lot in the past 5 years. What does the animal clinic look like? Does it look advanced, or does it look like the hospital of 50 years ago that was an old house?
Excellent point. And that's a good segue too. I wanted to ask you guys while I had you on, I know you have involvement daily with clinic expansions, remodels, ground up construction, that sort of thing. If we can just kind of touch on that from an equipment standpoint, are there any trends? If you started from a blank slate, an associate want to go out on their own and they're going to start with a leasehold space, are there any things that are going on their equipment list today that weren't 5 years ago, or kind of anything new that you're seeing consistently with new hospitals?
I'd say, over 11 years of doing this, I say 50% opened with dental x-ray 11 years ago, 10 years ago. Now it's 100%, whichever form it takes. I would say currently over the last few years, things like electrocautery, electrosurgery, vessel sealing have really become a want. And sometimes it becomes tricky to fit it all in, but it will become a quick purchase. They've opened, if that makes sense. So within that first year, they can't afford it in the bank loan, but they decide with a bit of cash flow, it's why did I ever not get this? Because I knew I wanted it. Those are a couple of the things that I see. Ultrasound, whether it's a little handheld or it's a larger unit, I would say probably about 50% start with ultrasound. It truly just depends on the doctor's experience. If they're comfortable with it, it's a non-negotiable for them. If it's something they're less comfortable with, then they want to have it as an option, a service, something they can show the customers they can do, which kind of is reflective of their reputation as a vet, right, to a degree. I would say ultrasound a little bit as well, but those are the ones I see mainly.
What you, Danielle?
I would 100% agree with Matt on the ultrasound being something that people are starting with now. Sometimes therapy laser might be something they may add, something along the rehab line as a startup. From a design standpoint, if you're wondering, just making more room in the hospital for technologies by making their waiting rooms smaller, doing exam room check-in and check-out with their clients so they can just dedicate less space to, say, waiting and lobby, and more space to maybe adding that dedicated dental suite or a specialty surgery suite. I think that's something I'm seeing that's a little bit different than 5 or 10 years ago. It really is a more focused on the services we can provide and not just how grand the waiting room looks when I walk through the door.
I'll really back that up, Jimmy. That the smaller waiting room to get in the extra exam room or to get in the extra something else. I think waiting in cars curbside during COVID just took away any awkwardness that maybe that brought out in people right prior to COVID. I think it was just something that you had to do during COVID, and waiting room's great, but if you can check somebody in and take them to an exam room, great stuff, right? It's the waiting room is just really waiting room, right? What can you do in there besides wait? Not a lot. So that's definitely something I'd agree with Danielle. That's a great point.
Those are great points. In the remodels or expansions that I've seen, remodels specifically, if they're not wanting to extend the roof line, they steal from the lobby reception area a lot of times. To your point, that's a great piece of real estate. We can add another exam room over here. You mentioned hydrotherapy. Are you guys seeing more clinics decide to expand into that?
I mean, I see a natural progression if you're bringing on advanced imaging for, say, CT and MRI. You open yourself up for the opportunity to add rehab because you're now starting to perform some of those surgeries. These animals are now needing rehab, and it does take up space in your hospital. So you do have to have the space to do it. I mean, hydrotherapy is going to need a larger room to do that. So if you are in a leasehold, may not be an option for you now, but I think as some of these doctors are looking to, say, relocate or build their second practice, it is definitely something that they're looking to bring in as another revenue stream.
Matt, you and Daniel both mentioned earlier advanced imaging. I know this isn't something that you're specifically trained on and fully versed on per se, but I do know that you've dealt with this quite a bit. I'd love for you and Danielle just to share your thoughts on what you're seeing in the field in terms of general practices and their open-mindedness and or thoughts of pursuing something like CT or other advanced imaging equipment.
Sure. So I think off the bat, much like ultrasound used to be, 5, 6, 7 years ago, there's maybe an element of concern, fear, whatever you want to call it, that a practice can successfully adopt and make a return on their investment in such a piece of equipment. Ultrasound was not the norm in veterinary practices 7, 8, 9 years ago. Right now, it's getting more and more normal. CT is not the norm in veterinary practices right now, but over time, it will be. Things naturally just progress that way. So what I've seen from the doctors who have taken on CT in my years is when the doctors look at what they are referring out initially for advanced scans and just do the math on it. And when doctors look at the prices that the specialty places will be potentially charging for those scans, just for the scan, nothing else. I think there's an element sometimes where compliance becomes an issue for their customers who maybe they decide they don't want to spend that kind of money on a CT elsewhere. I've had a number of veterinarians take on CT with those kind of reasons and thoughts, front of mind. And it was with me and kind of the options that we had that we kind of looked at, how that return on investment financially would work, over whether it's 5-year financing, 7-year financing, whatever it may be, right? We kind of looked at the options and how they would do X number of scans a week or a month over X number of years to pay it off. And, I placed a CT with a holistic veterinarian, right? Which you sit there and think, holistic veterinarian and CT, is that not either end of the spectrum? No. This holistic veterinarian had everything. I mean, they had a hydrotherapy treadmill, laser, surgical therapy. They had the lot. And they were just convinced that it was one thing that they could do. And they adopted it with no problem. Part of the reason why they adopted it with no problem, Jimmy, and this is really crucial with any piece of equipment, but CT especially, is, the training program, which for us was basically 6 days split over 3 visits, 2 days of software and positioning, 2 days of, more advanced positioning, and then 2 days where a radiologist and or a surgeon came in and helped them view the scans, read the scans, and then scrubbed into surgery to show them what they could do off the back of the scans. And so the adoption was great. I've had other practitioners who've done it where purely it was a mathematical equation. I'm sending X out. If I keep them in-house, I make Y. I do my own orthopedic surgeries anyway. Why am I even bothering to send these out? And he was going to basically have paid it off in 2 years. And with the 5-year warranty, he would have been in gravy for 3 more years after that, right? That element of sort of discovering why they wanted to do it was the key. For some vets I've talked to, Jimmy, with those discussions, it became something they didn't want to do. But they had the time, though. They took the time to kind of think about it, talk about it, research it, feel it. Was it right for their practice? Was it not? And then make a good decision for them. And that's where I've seen it go with CT. I think there's practices that it'll be great for. I think there's practices that would need to change a little bit to make it great. but it isn't out of the realm for them to do that. And some practices where it's just really a non-starter. I think the key is just being open-minded to discussing it and doing your homework and then seeing if it works for you.
That's great, Matt. That's neat, and kind of brings back what we mentioned that Danielle said from the get-go, which was kind of an interest. For some folks, it's purely an interest thing. And if you peel back the onion on that, it could work, And again, a lot of pet owner demand, whether it's just the quality of care or even a convenience factor, a lot of pet owners like to stay at their home vet for as many things as possible, whether it's convenience, comfort, or even cost. Sometimes the general practice can keep those types of things a little more accessible and affordable. That helps with the compliance piece. Thank you. That's a great topic to bring up, and I think we should probably expand on that at some point. We've got specialists in-house that I think we should invite on to discuss it. So guys, this has been a fantastic conversation. Really appreciate your experience and your knowledge and your insights, and it's been a great discussion.
Thank you for having me on. And, I am very excited to see what the future of veterinary technology and equipment brings, because I feel like every few years we are always wowed by something. And I'm very excited to see what the next couple of years brings.
Awesome. Thank you, Danielle. And let's put an earmark in this point in time and see if Matt's prediction comes true about minimally invasive surgery in 5 years from now. So
72.46%, Jimmy.
Oh,
you can
okay,
hold me to it.
All right. I want to have you back on here in 5 years. Mark your calendar. So thank you guys so much for coming on the podcast, and have a great rest of your day.
Thanks, Jim.
Thank you.
Thank you for listening. Join us for more ideas and inspiration on the next All Things Veterinary podcast.